else, I felt like.
At 27 years old, Melissa found out she was HIV positive.
Once I found out I was sick, I felt disgusted with myself and what I did to my body. And
she contracted the virus through intercourse. Melissa says she turned to the streets at a young age and developed an addictions problem. Finding out she was HIV positive was devastating.
I had my family, but they weren't that great supportive. They looked at me, really, it's your fault why you got sick. And it hurt me. It really did.
Melissa is sharing her story at the Saskatchewan Indigenous HIV conference in Prince Albert. The All Nations Hope AIDS Network spearheaded the meeting.
And we've been hearing the cry from our members around some of the issues that they face here in the city of Prince Albert.
The CEO of the network says a cultural approach is needed to deal with the problem.
There's a need here in our province for outreach that is being conducted by Indigenous people, for Indigenous people.
The HIV transmission rate among First Nations is 3 times higher than the national average. In 2012, there were 177 new cases of HIV diagnosed in the province. Of those, 74% were Indigenous.
We don't know the accurate number of Indigenous people living with HIV because they don't make it to the doors of the existing agencies, systems, and institutions that are offering testing or offering. And why would they go there if there's not additional support for them to deal with a positive diagnosis?
Oh, yes.
The numbers are getting noticed by the international community. Trevor Stratton is HIV positive and represents the Canadian Aboriginal AIDS Network.
So a lot of eyes are turning to Canada, and when I work internationally, people say, oh, I'm sorry, Trevor, but we're using Canada as the bad example about Indigenous people and HIV.
Injection drug use and poverty are contributing factors.
Talking about a lot of health and social conditions that are really impacting the Indigenous population here in this province. You know, if addictions is driving HIV in here in this province, are there adequate services and support for people who are testing positive, who are also living with addiction, who are also, maybe possibly homeless, living in poverty?
The Canadian Aboriginal AIDS Network says there needs to be more messaging targeting First Nations across the country.
That can be a really isolating thing, and it can really put people at more risk for much poorer health outcomes. If someone doesn't have the support, they may continue on the same path that led them to get HIV. 50% of our new infections in the Aboriginal country are in our women. And like almost 60% of new infections are driven by injection drug use in the Aboriginal community. So the messaging that's going out to mainstream Canada isn't reaching our women. I don't think it's reaching even our Two-Spirit youth.
For Shaw, I'm Lisa Rism.